So today I will present the project I did in my master thesis. And yeah, okay. So as a brief introduction, so adult spinal deformity affects between 32 to 68% of the population. And in case of severe deformities, as for example the gentleman in the picture, the patients usually undergo surgery, which usually is spinal fusion. But yeah, spinal fusion has some complication, where one of the most common one is proximal junctional kyphosis and failure, where the patient, so up to 46% of the patient is affected of it after surgery. So in previous studies, Ignaziak et al., they investigated the link between sagittal alignment and spinal load, and they showed how there are higher compressive forces with worse alignment of the spine. So the aim of this project was to investigate the link between spinal loads and the risk to develop mechanical complication, especially PJK and PGF, with the hypothesis that patients with greater postoperative loads develop junctional complications. And this was a retrospective, prospective, multicentric studies. And we collaborated with the European Spine Study Group, where out of their clinical data set, we took 94 patients. So we selected 94 patients with the inclusion criteria of them having T10 to pelvis surgery and at least 2 years follow-up. And in our data set, we had 46 patients that didn't develop any mechanical complication, 36 that developed other mechanical complication, and 18 that developed either proximal junctional kyphosis or failure. Good. So, and we selected the X-rays at the first X-rays postoperatively, so within 6 weeks. And then we measured and analyzed the vertebral centroids, vertebral angles, as well as sacral slope at pelvic incidence, that then were used to as input for our personalized musculoskeletal modeling in any body, where we performed an upright standing simulation. And the fusion was implemented as quasi-rigid, which means 90% of the moments were undertaken by the instrumentation and 10% of the moment by the muscles. And then eventually we analyzed the forces at the adjacent segment, which in our case was T9 to T10 joint. So I will already jump to some results. So what we wanted to see is how the compressive forces change in these 3 groups. And then as you can see, we found that there are higher compressive forces in the group of the people that develop proximal junctional kyphosis or failure, respect to the non-group and the other mechanical complication group. And then furthermore, we perform a ROC analysis, where we wanted to assess if compression forces then could be used as PJK predictor. And then we found an area under the curve of to be 0.72, which means that our model could differentiate 72% of the time correctly between this patient developed PJK or this patient did not develop PJK. And we found a cutoff value of compression to be 1.043 body weight, which means below this value it's less likely to develop PJK, and above this value it's the likelihood increase. Then as a summary, so we've shown you that compressive forces are greater in the PJK-PGF group. But then I want to highlight that we focus only on the alignment, so we disregarded other mechanical or biological factors, such as muscle quality. This also because we wanted to focus solely on the alignment, and then don't have any other confounders. And but nonetheless, we shown that compressive forces could play a role in the development of PJK and PGF. And yes, with that, I thank you for your attention.